With that, thank you, everyone, and I'll open it up for questions.
Maintain that your approach was more strategic and could have been slower, but how do you explain, while focusing on those high-risk groups, that there's so much unused vaccine that seems to be the focus of why Rhode Island's response has been slow? Why couldn't you have realized that there was an extra supply that could have been moved out quickly? I guess there seems to be a disconnect as to, okay, we took this approach, but why is there so much left over?
Yeah, I'm glad you asked, because it allows me to connect the dots on what I was explaining about our redistribution process. The vaccines that have been noted as or considered unused or, on the shelf were not held back in any way. They were part of this distribution and redistribution process that I explained that happened over the course of that 14 days. When you have multiple partners that you have to get vaccine out to, it takes the time of packaging and then repackaging and getting it out to the right city and town, getting it out to the right hospital provider, getting it out to the right other partner that we have with vaccinating. And in some of those situations, because we did a good job in minimizing waste, which also takes time, we have wasted 0.2% of vaccine. So that's almost negligible. Usually you aim for keeping it below 5% or 10%, and it was at 0.2%. A big part of that is because after we would distribute, if vaccine had not been administered, we would collect it back and then redistribute it to another entity that we could. And when you have multiple partners, that was taking time. You have to package it right, it has to be stored appropriately. That is what contributed to that sort of inventory of distributed or redistributed vaccine that made it seem as if it was sitting on shelves, but it was really in that pool of vaccine that needed to go back out. Now that we're moving to a faster approach, we will not have that pool. And as soon as the vaccines arrive, they will be able to go. And we're trying to make it so that the vaccines go directly to these fewer number of central mass vaccination sites.
Wherever it was in the system, I think the criticism is that it wasn't going into people's arms. And that, I know Harvard gave Rhode Island an F. That was the thing. Well, the best thing to do is to get it out there.
Yeah.
So
it did eventually go into their arms. When you looked at the 14-day time frame, almost 100% by the time you got to that 14-day mark did get into arms. It wasn't as if it just sat there and never got there. It just was that process of getting it to the different sites, and that's too long. That's why that grade came through that way, and we acknowledge it was a way to get it to multiple partners, but it also took longer. So we achieved what we needed to, and we no longer need to stay with that. We have to get quicker. Shrink that time from 14 days to at most 7, and make it even less than that if we can have the vaccine shipped directly to the sites where it will be administered.
Does this mean there's more now? There's some sort of surplus that you can now flood into the mass vaccination sites on top of what you're getting per week? Is there that extra? I guess the disconnect is there an extra supply sitting there that can now go in right away?
As we cut back on the number of vaccination sites and go more towards a fewer number of centralized sites, we will have more vaccine that's able to get pushed out into the community because they're not getting redistributed to one of the many sites that were out there. Our goal is by the end of February that any of those that were in that circulating redistribution process, because of the large number of sites that it was being sent out to, will be almost negligible, because we can either have vaccines go directly to sites or significantly minimize or decrease the number of times we need to redistribute vaccine.
Was any portion of that a mistake in terms of how that whole redistribution system was going and the slowness of the pace?
Yeah, I mean, it was part of the, we didn't expect it to be measured as that slow, but we knew logistically, in order to achieve the targeted approach we needed to get at the individuals who were highest risk, it just literally took that time to be able to do it carefully and effectively. We accomplished what we needed to, we recognize you cannot continue this entire response doing that. We got the largest drop in hospitalization rates, and it's time to speed it up. And thanks to our partnership, we have the capacity to do that. We already have 10,000 plus people who have appointments in place, and you will see that continue to get accelerated, that number continue to decrease.
Doctor, we understand that folks who are going to these new clinics that open up today are signing up when they're 65 and older, in addition to 75 and older, and are getting vaccinated. Is that a mistake? Is that part of the plan? Is that good or bad?
We recognize that when our messaging was put out yesterday about the sites opening up, it might have been somewhat confusing because we said 75 starting today and 65 on Monday. So with this being with the first 24 hours of opening, we want to, give people the benefit of the doubt to know from now till Monday, it's 75 and older. We want to get as many of our 75-year-olds and older into our large vaccination sites and to continue with our municipalities, as well as have the opportunity in our pharmacies. And then on Monday, be able to start scheduling 65 and older. So we're giving people the benefit of the doubt, but we will, if we need to, and have the capacity to, delete appointments if they are made by individuals continually who do not qualify. So we want to keep things moving as much as possible. Focus now on the 75 and older. If a few people didn't really realize and tested to say that they are 65 and got through, we'll, finish that process, but over the next 24 to 48 hours, not have that be the primary flow throughput. We want our 75 and older to be able to get vaccinated between now and Monday.
When will that change? They're signing up now. I mean, everyone who's 65 and older is signing up now. The system allows them. Some folks in Providence is advertising that 65 and older can get vaccinated. Is this practical? I mean, how are you going to manage that, and what is the cutoff when you're going to start kicking 65-year-olds off that have signed up today? How does that work?
Yeah, so there are two different elements that are in place. We do have the ability, if it's overwhelming that people 65 and older starting now are vaccinating, we do have the ability, if we need to correct that between now and Monday. It's a short window, so we're, gonna go carefully there. We really want to message for 75 and older between now and Monday to be able to take advantage of those appointments, and we can make that correction. Separately, we have our high-density community strategy, where there are specific zip codes. Central Falls was our starting one. We have 2 to 3 zip codes in Providence and in Pawtucket, where we are working with them, similar to how we have done in Central Falls, to be able to start to move forward because the rates there are higher, and part of that strategy has involved additional ways to get them vaccinated. So that might be some of what you're hearing in Providence if it's one of those zip codes that we have planned to focus on. But by and large, for the main group, 75 and older now through until Monday, and then 65 and older across all channels starting Monday.
I'll toss this question out to you or Secretary Pryor. Has the governor explained to you why, to many Rhode Islanders, she clearly considers her employment security more important than an orderly transition of government to a McKee administration? And when does she plan on resigning?
Can certainly reach out to her office to be able to share that. See if
of the administration, you've always been the only representatives of the ongoing active administration. So we're asking you, since it's clear that Governor Raimondo didn't want to take the time to come today, and Lieutenant Governor in waiting McKee isn't here either.
I can share, certainly from my perspective, that Governor Raimondo has been fully engaged and involved in our process. We've worked closely with Governor Raimondo as well as with Governor McKee, who we continue to meet with on a daily basis. So from that perspective, I can say that it is continuing forward. It's a unique situation.
Reported as hearing about significant appointments through the media. That doesn't speak to me to an ongoing involvement. The months of listening to Lieutenant Governor McKee talk about his inability to be involved in ongoing decisions doesn't speak to an involvement. I don't know if there's ever been a real involvement. Is it time for Governor Raimondo simply to resign and allow an orderly transition of government to take place, in either of your opinions?
I can confirm, as can my colleagues, that there has been regular involvement given the meetings that we have had on a daily basis. The change that was shared was one that has been part of the process and the leadership of our COVID unit. We have shared that with Lieutenant Governor McKee this week. As it's rolling out, the position is starting early next week. That is a normal part of the transition and engagement. We're continuing to interact multiple times a day.
Doctor, let me follow up on that. Governor Raimondo kind of quietly extended her executive order to March 17th, probably long after she's going to be gone. And given everything that you said, the 2%, hovering around 2% infection rate, the hospital rates are down, all those things we talked about a year ago that you wanted to keep under control. I assume you had some type of input. She asked you, should we continue this executive order? Did she ask you? Mm-hmm. Okay. And so what did you tell her from a science and data perspective that we really need to keep this executive order for another month, maybe long after you're gone?
We have been concerned.
The emergency order, I'm sorry, the executive order.
Yeah, we have been concerned about the variant, the new variant, and wanted to make sure that we have an understanding of how this significantly more contagious variant will impact Rhode Island. We recognize that as decisions are made about executive orders, at any time, based on the data, we can make updates to those changes. As we are sharing incremental loosening of restrictions each week, we are making updates to executive orders each time we're doing that. So that's a process that will continue. We're going to continue to understand how the presence of this new variant in Rhode Island impacts us. And similar to how I expressed today, thankfully, that we are loosening restrictions on visitations, we hope to continue to be able to go that way as long as we're continuing to be effective in our overall approach with testing, treatment, and vaccinations.
Order seems to trump. Just hang on a second. That emergency order seems to trump some common sense. I got an email from a parent. URI was supposed to play Bryant. I mean, can you imagine, at the end of February? Probably the only people going is a parent. And that game got canceled. But URI is going to start playing now. And I don't know if this is coming from the university or from you, from the Department of Health. Why couldn't somebody sit outdoors, take it outside, and watch a game in February when the government says you can't do that? Why is that?
Yeah, I cannot speak to the specific scenario that you were referring to. We do have guidelines that allow for spectators to be in place, and we're continually assessing, particularly with the consistency of our data trends, given our overall positive response, how we can make improvements in loosening. That's something we're looking at on a regular basis.
Just one final question. Would you continue to describe Governor Raimondo's handling of all of this as brilliant?
Absolutely. She is a brilliant individual and leader. She has continued to be engaged directly with us. Thank you for your questions.
Dr. Alexander-Scott,
She's here.
Yes.
Please explain to us what the appointments will look like if somebody under the age of 65 registers for a vaccine at one of the mass clinics. Even myself, as a 24-year-old, was able to go through the entire process, put my real birth date of 1996 in, and I got a confirmation email, which I was able to cancel. But still, there are people that still want to go book an appointment, and they can through this system. Will they be turned away?
Yes, so we have this system established, similar to the way other states are doing. In order to go faster and simpler, the system is based on the honesty and cooperation of the people involved. There is an ability to self-attest to your age and who you are. Hopefully, for between now and Monday, only those who are 75 and older are doing that. Thankfully, as you went through the process, you canceled it. We do have the ability to, on the other side of it, cancel the appointments or delete them if we have individuals coming through who are not within the eligibility criteria. We know that this was a lot of information that just got started, so we're giving people the benefit of the doubt, but we look forward to building this out based on trust and cooperation of the people who are involved so that we can have this move as quickly and as simply as possible.
Why isn't there just an age
Instead of
filter?
people showing up to these mass clinics and saying that I'm not under the age of 65, or I am under the age of 65, you will just be deleting their appointments and communicating that with them ahead of time before they go to these clinics.
Right, we have the capacity to do that.
A follow-up question to that as well. Is there any updated plan on people who are homebound right now? How are they getting vaccinated through the state?
We are continuing to work through the process of having a home care entity be able to engage with those who are homebound. We've also worked with our municipalities, given the availability there. We need to continue to advance on some of the planning there because it is a priority.
When will there be news on that?
We'll circle back with you next week with that.
Doctor, I have two questions, one for you and one for General Callahan. The first, the state's targeted approach was designed to cut down on deaths, but January was the third deadliest month so far, and there have already been 120 COVID deaths this month. Has the approach cut down on deaths, and if so, how do you know?
Thank you for that question. We understand that fatalities lag to a certain extent in terms of the impact. So we are anticipating that similar to the cases decreasing and the hospitalizations decreasing, that will happen for fatalities as well. We need a couple of extra weeks to be able to determine that, and then would be able to respond accurately from that standpoint.
General Callahan, I have a question for you. If you can come to the mic, please. Governor Charlie Baker said that they were informed last night there would be significant delay in this week's vaccine shipment because of the weather in the South, and that he was going to be sending some of his National Guard to pick up the vaccines themselves. Are you plan on doing that? What's sort of happening here?
Yes, we have no news on that. There's been no news to us relative to any type of delays that we're concerned about, and if it does come to fruition, then the team will get together and we'll get after it. Very confident that we can duplicate what Massachusetts is doing if we're needed to do it.
He said they're coming out of Tennessee and Kentucky, but for right now, Rhode Island hasn't.
Right now, we have not heard of any delays just yet, prior to coming on stage.
Dr. Alexander Scott, why don't you put an age filter on the sign-up? I think you're relying on the honor system, but unfortunately some people either may not know they're supposed to do that, or some people may take advantage of it, and then meanwhile you have other people in the whatever the next up group is that are waiting, and people may be jumping them. Why not just put an age filter on it?
We do have that in terms of people being able to put their date of birth from that attestation standpoint. We will continue to explore all forms of technology in a way that can support even further as we go, but we wanted to get it going first. This is similar to how other states are doing it from that self-attestation standpoint, and as we go, we'll continue to explore and implement additional ways to support the work we're looking to do.
Massachusetts, the website, in Mass, the website crashed when they went to wider eligibility. On Monday, will the state website here in Rhode Island crash?
We have done everything we can to help ensure that the website will continue to function effectively on Monday. Today is a great test of that to help reassure, because we've had over 10,000 already sign up and we're doing well. So we are pleased with that thus far, and each day it's an assessment to help ensure it stays that way.
Yes, we've heard from a lot of senior folks who don't have internet, who are using the phone line to make their appointments and they can't get through. As more and more groups become eligible to register, is there a way that the state is improving that phone line? I know it's automated, but are there ways to improve that?
Yes. We made changes already today to improve it by going from automated to adding live individuals on the phone line to be able to help, and we're continuing to monitor it several times a day so that if we need to add additional vaccines to be available for those who call in, we are able to do that. So we'll continue to make adjustments as we go, recognizing the importance of the phone line as a mechanism for people to register.
I just have one question for
Secretary Pryor. Both Connecticut and New York have increased their gathering limits for both special events and weddings. I'm hearing from
a lot of business owners and brides who are saying, I'm not going to have my wedding here in Rhode Island. I'm not going to host an event here in Rhode Island. I'm going to move to, Connecticut and New York to do it. Massachusetts and New Jersey are probably going to be upping their limits as well using these rapid tests. Is there any update on this? Are we going to be able to increase gathering limits?
There is, yes. First of all, please note that in New York and Connecticut, they're predicting that they will open their guidelines, that they'll add flexibility in a month. Last week, we opened, for purposes of event professionals, the guidelines so that we could have events of any category up to 30 occurring now and through this month, and up to 50 participants in weddings. So we actually are ahead of those nearby states in opening up. We have had dialogue with event professionals and with venues of assembly, meaning auditoriums like this one and other arts centers. As recently as yesterday, Dr. Alexander Scott and I participated in an active discussion with event professionals and the Hospitality Association and with tourism representatives about what we can do to responsibly open into the future. So that's one of the areas where we're looking for flexibility. And let me also note there was a question earlier about, I think Jim was asking about, what else are we thinking about? What can we reopen? It was embedded in his questioning, and to both of your questions, we're looking at instances where in the medium and long term we can offer more flexibility. Event professionals is a key priority. We're also looking at residual aspects of the guidance that's been there since the early stages, things like cleaning surfaces, things like, some of that needs to continue to exist, by the way, things like the self-service soft drink decanters, things like whether haircutters, professional haircutters, can double book appointments, even if they keep their appointments very distanced, separate rooms with all kinds of sanitation and masking standards. We're relooking at all of that so that as the public health conditions hopefully remain strong, meaning remain favorable, we can look to those revisions, obviously all while tracking the strains and their emergence. And the last thing I want to say is there was a question, I think, Pat, about our governors, and I do want to add, on all of these points that I'm describing, Governor Raimondo is very much on the job and is very invested in governing as we roll out these changes, and Lieutenant Governor McKee is heavily engaged and is helping us consult stakeholders, make these decisions, and undertake these changes. So that process is working very, very well. Thank you again.
Why isn't he here?